Howdy, this is your Houston chiropractor, Dr. Tristan Went, coming to you from Advanced Chiropractic Relief in Houston, Texas. And today I am joined with Mr. Hank. Mr. Hank is a new patient here at Advanced Chiropractic Relief. He has been adjusted quite a bit in his life, but he has never gotten a full ring dinger. Mr. Hank's coming all the way down from Alberta, Canada. So quite a trip, huh?
Yeah.
You and the wife made a little bit of a vacation out of it, though.
Well, we made a detour to Yuma, Arizona.
Nice. So Mr. Hank is coming in with primarily low back pain, with also some right SI joint pain. He's getting bilateral numbness and tingling into the lateral portions of his legs and the lateral portions of his feet, which is the S1 nerve root. He's also dealing with some thoracic spine pain and stiffness, some neck pain and stiffness, and then some right shoulder and left wrist pain as well. Mr. Hank was telling me a funny story a little bit earlier. He actually sees another chiropractor up in the Alberta area who does something similar to what we do here. It's not like a lot of the stories that we get where docs are saying, hey, don't go see those guys down there in Houston, they're gonna kill you, which has never happened. So tell me a little bit about the chiropractor you were seeing up there and what he does in his office.
I have to say he's been very good. I have mentioned a few things, but I don't want to say too much. He's done a very exceptional job, but I felt I just need that little bit more.
Yeah, absolutely. And that's what brought Mr. Hank all the way down to Houston, was to get that full ring dinger. So my only advice to that guy, if you're DC up there who's doing a great job already with you, would be just to come up here and take the seminar with Dr. Johnson so he can be the first official ring dinger chiropractor in Canada, because we don't have any official ring dinger docs up there yet. So.
Then I'll lose my excuse to come down here though.
Well, you're always welcome in Houston, you know that. All right, so we're gonna start with the posture analysis first. Mr. Hank, I'll have you close those eyes and then bend that head all the way forward, and then all the way backwards, and then back to neutral. Good. So I've already gone over all this with Mr. Hank, but that number one thing that I'm seeing right now with that posture, you can open those eyes, Mr. Hank, is that forward head posture. So for every inch that he is out forward, that increases all the stress and these ligaments and discs of your spine to have to hold that head up in gravity. You can also see here that you have more room on the left-hand side than you do on the right-hand side, so that pelvis is also translated to the right. And so we're gonna be going through all the adjustments today, and then we're gonna take a look at your posture at the end and see all the changes that we've made, okay? All right, so I'll have you go face down into this paper, Mr. Hank. Since you're a new patient here, we're gonna start with the BioPhysics adjustment first. I'm gonna get a feel for your spine and the muscle and ligamentous laxity of your spine, and then I'll get you on the ring dinger decompression table after that, okay? So we always start with our leg length checks here. So he is short on the left by about 1/2 inch in this position. And then as I bring those legs up, it actually gets longer by about maybe 1/8 inch on the left-hand side. And that tightens up in that low back and pelvis, right, Mr. Hank? Yep, so we're gonna test that again after the adjustments, and we're gonna see if we've made any changes there as well, okay? And I know you've been adjusted quite a bit, so I don't need to do all the explaining on these tables, huh? You know all those louds and bangs and clangs aren't your spine, it's just the table moving around. All right, so I'm gonna start on this right SI joint here. You get the easy job, all you gotta do is breathe and relax, okay? Good. Loosen this table up just a bit. Perfect. Now left SI joint. Good. I'm gonna move into the lumbar spine now. These could be a little tender at first, but that's just because they haven't been adjusted like this, okay? As from watching the videos, you know we're old school bone movers here. Yes, sir. Good. Nice deep breath. Good. I know you felt that one. 2 more here, okay? Good. Last one. Perfect. A little deeper than the videos make it look, huh? So now look at the leg length change that we already have. He's exactly even now in this position. As I bring it up, Mr. Hank, does this feel any easier than that first time to you? Does this feel any easier to you, Mr. Hank?
Yes.
Good. And that's just from, and remember the leg lengths that we were talking about earlier? So now that you having an even leg on that left-hand side, that confirms that this is just a functional leg length deficiency, not an anatomical deficiency. So the orthotics that you have could be beneficial for your feet, but the heel lift that you have in there, now that you've been adjusted, now that left leg is gonna be almost longer now because you have that heel lift in there. So I would honestly recommend getting that out of there after you get adjusted. So that'd be my recommendation to you. But again, I'll let you talk with the chiropractor that gave you those. So now I'm gonna start in the thoracic spine. I'll have you take a nice deep breath in through that nose. Blow it all the way out. Good. Let all that air out there, Mr. Hank. Good. Oh yeah. Good. Last one right here. Perfect. A little deeper in person, huh? So I'm gonna have you scoot down just a little bit for me here, Mr. Hank. Get those shoulders off that headpiece. You're gonna feel your head popping up next, okay? So this is where we work on that forward head posture in here. So I'm gonna work on reestablishing that normal forward curve. Good. Last one. Good. Have you go face up for me now, Mr. Hank. You didn't think the new guy was gonna take it easy on you, did you?
I hope you didn't.
Mr. Hank's gonna be down here for the twice a day for 3 days, so I'm sure we'll be doing lots of update videos with him. I know some chiropractors and some people think you're not gonna have your head attached after this visit, but I bet you will. We hear all kinds of funny stories in here.
Well, at least you make us laugh a little bit.
Exactly. We like to have a good time in here.
It's not a laughing matter getting crunched like that.
Right? You gotta have some fun with it too. If the chiropractor's not in there having fun doing what he's doing, is he really doing a job that he loves? So I'm gonna have you go arms out to the side like a big old T.
Where?
This is my Dr. T adjustment.
Okay, Dr. T.
So I'm gonna get you to scoot down just a little bit more for me so I can get those
Just that
shoulders.
way?
Yep. You're a little longer than the average bear, so your legs are hanging off there now. So I'm gonna start with these AC joints. Okay, that's clavicles. Now anterior ribs. Good. Last one here. Now loosen this table just a bit here. Good. Now I want you to relax those hands right there on your chest, okay? So I'm gonna decompress you from the lower end first. All you gotta do is let this go like a limp rag here. Oh yeah. Should have felt that from your knee all the way up into your low back, did you?
I was looking forward to that one, but I don't know.
Well, you can't get out of here without me pulling your leg, you know that. Good. Keep those teeth together for me so don't bite that tongue. Yes, sir. Should have felt that all the way up into the low back.
Sorry for the sound effects.
Oh, you're fine. So I'm gonna help you up here next. We're gonna face your wife. I'll help you up. Perfect. You can swing those legs all the way around here. So now we're gonna work on those shoulder joints. Humeral joints here.
Humor, all right.
Yeah, humerus, huh? Ooh, that's tight right there. So we'll start on this right hand side.
That's that sore one then.
So we'll go through a little bit of range of motion. I'll let that go for me there. Good. I know it's painful here, but I'm trying to go get a little bit of that range of motion first.
It's not painful at the moment.
Good. So if you relax that elbow for me so I can bend it here. Good. I'm gonna reach around here. And then look up at the ceiling for me. Good. I know you felt that one.
I did.
Same thing on this left-hand side. A lot better range of motion on this left-hand side. So I'm gonna be giving you some tips and tricks throughout the week also, because I'm gonna want you to start working on the range of motion for that right shoulder. Good. All right, so I'm gonna start with your elbows next. As you know from the videos, we do full body adjusting
Oh,
here.
yeah. I know.
Okay, so now you roll this arm all the way over for me. Good. Good. I know you don't hear the loud pops and clicks on that, but you felt all that movement underneath your wrist there, which is exactly what I'm looking for. Good. We're going to decompress your entire body here in just a second. I'm starting with your fingers, your legs, and your hands here, but then we're going to move to your full spine. Good. Yep. Good. Middle one right here. Good. 5 for 5. We'll take it. So next, Mr. Hank, we're going to get you up and get you on the ring dinger table. You've had mini dingers from your old chiropractor up in Alberta, but this is going to be the real deal full tilt. So have you go butt here, head up
This
this
is the
way.
part I've been really scared about.
Like Dr. Johnson always says, and I've told you a few times already, I don't have any heads on my trophy wall yet, and I'm not going to start with yours, okay?
Yep. Sounds like a good plan.
So, Miss Linda, if you want to hold on to those for just one more second there, I want to make sure that when I make that thrust, those glasses don't go flying off your face too. I don't want to step on them either. I'm a lot better at adjusting spines than I am broken glasses. So I want your legs just to relax as this table brings them up. And you're going to be a little bit taller than our average bear, so I'm going to
The knees have to be there, right? On the corner?
Yeah, so once the table gets its platform all the way
Yeah,
up,
I think that's,
I'll move you around before I get you pinned down.
Oh,
Okay?
okay.
Good. So I'm gonna make sure this pelvis is below these pins. I'm gonna get you to scoot towards me just about 1/4 of an inch. Perfect. Right there. Bring those legs just a bit higher. Right. So I'm gonna pin your pelvis in here.
There we go.
And all this is doing is creating my stabilization point.
I know.
I want you to stay nice and flat for me. I don't want you to rotate. Good. Got your squeeze on you now, huh? Miss Linda, you got any questions for him? He's not going anywhere right now. All right, Mr. Hank, come on, you lift that head for just a second. So I get this towel underneath that occiput. You can relax your head all the way back. Just a reminder, I'm gonna have you keep your teeth together for me, just so that tongue doesn't get between there. And I want you to take a nice deep breath in through your nose, blow it all the way out. And then put your hands on your belly button for me if you don't mind. Good. Oh. Good. Nice deep breath in through the nose. Deep breath in through the nose, out through the mouth. You should have felt that all the way down your spine. A little deeper than what your chiropractor in Alberta was doing, huh? Deep breaths in through the nose, out through the mouth. Good. 3 more, just like that. Good. And look, relax those legs too. He's still kicking. We're not checking for upper motor neuron lesions there. We're not. Some chiropractors, orthopedic surgeons thinking we're checking on if we've created an upper motor neuron lesion there, but that's not what we're checking on. Good. So I'm gonna work on your cervical spine here. Should be relaxed on you already. That first one's deep, isn't it? So have you tilt to the right with me, and we're gonna look to your left. Good. We're gonna look, tilt left here. Yeah, a little bit more. Let that weight go right here. Good. All right. Now that is your first Johnson BioPhysics adjustment.
She's laughing. She thinks it's funny.
That's just,
Well, you didn't scream nearly as loud as I thought you would, though.
Are you still on? You still videoing?
Oh, yeah.
To my son Brad, I got her done.
We got her done. Here, I'll help you up now.
He's been encouraging me to go.
Well, you need to bring him on down here for your next visit then. You can do a whole family affair.
He might be coming to visit.
Make a whole trip out of it. Bring the chiropractor with you too. You can give him his first ring dinger. Because I'm telling you that I'm going to have you try to explain it to the audience out there, but it's very, very hard to explain what you just went through. It's a sensation that you've never felt before. So I'm going to have you stand right here facing this mirror now. You're already a little taller. You feel that? You feel taller right now? Because you are.
I can't explain it, honestly.
Yes, sir. So I'm going to have you close those eyes one more time. Bend that head all the way forward and all the way backwards for me.
Backwards.
Yes, sir.
Oh.
Already better range of motion. You feel that, don't you? Back to neutral. Good. Look in the mirror now. So we've got that head way
I
back
don't
over
have
our
my glasses,
shoulders.
so I can't see me.
Here, I'll let you grab those glasses so you can see. I want you to see the results. We do this for the video as well, but this is primarily for you. I want you to see all the changes
Do
we've
you
already
fix,
made.
do you chiropractic bad eyes too?
Some patients report that their vision actually is better after getting adjusted, but I am in no way treating your visual status.
His shoulder's a little higher.
Yes, you see that? We've already got some
Yeah.
leveling there. They're also squared off. You don't have as much of that rotation. That's why I know you're a side sleeper with going in here. We've also evened up that spacing here between your pelvis. Do you see that already?
I do.
Yes, sir.
There's a bit of a space here.
All right, but you're still in Houston, so I gotta shoot you.
Okay, you shoot me.
So I'm gonna bend this head forward here. So all this does is bounces all these muscle spindles. It'll help relax some of these tight muscles.
I wondered what that did. That feels really neat.
A lot deeper in person, huh? Much like the adjustments, this thing looks like it doesn't do all that much when I just hold the trigger down. But I promise you get this thing in here on your spine, it feels really good. Right, now this is that extension homework I was telling you about earlier, okay? So I want you doing this 3 sets, 15 reps every single day. So 15 in the morning, 15 at lunch, and 15 at dinner. What it's gonna look like is it's 3 parts. Part 1 is shoulders up and all the way back, all the way like this. I'll have you go through those motions with me. Good, up and then all the way back, palms forward. Good. So I want you to really squeeze those shoulders together right here. That gets rid of those unrounded shoulders. Part 2 is the most important. I'll have you hold those for just a second all the way back. Part 2, I want this chin to come straight back to the wall behind you. So not extension yet, come back to neutral. Straight back to the wall behind you. And now extend as far back as you can. So chin up to the wall. Good. One side here. I got you, don't worry. Like I said, I haven't lost the patient on the floor yet. I'm not gonna start with you. Relax those shoulders now. Good, and I want you to do that same thing where you bend that head all the way forward, all the way backwards. Should feel a little smoother this time. That's my WD-40 gun. We just oiled up that upper cervical spine there. Can you feel the differences just from that?
It's just, I can't describe it.
Yes, sir. And that's why I want you to get that chiropractor down here so he can get these things done himself, because it is undescribable sometimes, the sensations that you feel during that ring dinger adjustment. But like with any adjustment, all we're doing is stabilizing that pelvis, and I'm bringing your spine to tension, applying a very high velocity, low amplitude thrust, which is taking all those compressive stresses from the years of working and living and farming that you've been doing up in Canada. And we've gotten rid of all that in just that first decompression. So Hank is gonna be here for twice a day for the 3 days, so we'll make sure and do some update videos with Hank if he wants to. But I'll make sure he's asking about those when he comes in. You got anything else that you wanna say, Hank, after your first visit here?
No, like I said, I just can't describe. I feel so different. I feel loose already. One treatment.
Yes, sir. One treatment here at Advanced Chiropractic Relief.
And hi to the family up there.
You have to bring the family down here next time you come to Houston so they can all get a ring dinger, huh? Well, Hank, I appreciate you giving me the opportunity to work with you today.
Yes, and
it's
thank
been a
you.
pleasure, and we'll make sure and do some update videos later this week.
Okay.
All right. So this is your Houston chiropractor, Dr. Tristan Went, coming to you from Advanced Chiropractic Relief with Hank coming from Alberta, Canada, and we'll see you guys soon.